We are.
Okay, welcome back. Okay, so as I mentioned, we met you in Institute of Medical Aesthetics a few years ago when you were actively updating your skills in the field of lasers and aesthetic medicine. And then I found that you were always so active in taking part in different courses, different conferences, different seminars, contributing and sharing opinions on LinkedIn, giving advice on WhatsApp groups to the community as well, which I find very honorable. And I always give this advice to all the practitioners in Dubai. So I think it's about sharing. It's about receiving education, but then sharing what you know and sharing your knowledge with others. Especially, we always have new practitioners coming to Dubai, new therapists, new doctors, and they really value this opinion. At the same time, Dubai is changing always very fast with new demands from the patients, new demands from the clinic owners. So as a doctor and as a practitioner, you need to be proactive and creative in what you're going to do in order to stand out and to make sure that you're always active in the medical community. So for all those reasons, I'm very happy to have you on this channel today and on this Instagram Live. And I'd love to hear a little introduction from yourself as well, please.
So yeah, I'm a general practitioner. I have been in Dubai for 6 years so far. I do have aesthetic privilege, obviously. Recently, I gained the license for the lasers as well. I do have a functional medicine approach in some of my cases, not necessarily everything, but it is the area that I have touched as well. I'm a small business owner, so there goes that, you know, being active, networking part as well. And yes, I mean, in the core, I'm a real doctor, so I promised, you know, to myself and the world that I will be there and I'm helping. And by the end of the day, if there is a person that we helped in a day, it does make a big difference. So yeah, it's short.
Thank you so much for this introduction. So yes, lots of different hats, and especially as you said, you know, aesthetics, which I guess is your main activity, but also functional medicine, which I really always strongly advise all the aesthetic doctors to diversify their interest in treating aging by looking at functional medicine as well. And being a business owner as well means that you always have to think business and remain competitive. So can you describe to us what have been like the major steps, especially since you've been in Dubai, that you have taken in order to actively put your career, you know, in the forefront of the developments in the aesthetic and functional medical field?
Well, absolutely. The biggest turn that I made was the aesthetics, because it was not my attention at the beginning when I was finishing medical school. Absolutely, I said I would never do it. Dubai makes some changes, right? When you come here, you have to see how the things are going, what is working for you. You are able to compromise certain things, but some other things you're not able to. As I have been on the market for some time, you also network, you see the feedback from the business owners, from the market, and somehow I did a test trial with Institute for Medical Aesthetics. I did first the laser course. I fell in love in the amount of the physics and the science behind it. And then, of course, you have to do everything else. So I'm a Canadian board aesthetic medicine practitioner. So it took me that way, but it was something that I was not expecting. So it was the level of the knowledge, it was the level of the science. And then in the end, when I started practicing, it was as well the connection with the patients I was able to have.
Great. So back to I'd like to just talk a little bit about, as you said, you know, the laser course and the amount of science and physics that you actually absorbed from this course, because I was running this laser therapist course for 8 years. And I have to say that a lot of physicians often start by focusing on injectables and think that lasers is the therapist job or the beauty therapist job, and they don't necessarily integrate it into their practice in the beginning. But I would really strongly advise to look at that, because actually a lot of practitioners, as you said, they find themselves falling in love with the science and the physics of lasers, which actually there's probably a lot more science, you know, behind lasers than even fillers or Botox. And it's a field that you can really delve in, and especially in Institute of Medical Aesthetics, they have a great trainer, and my dear friend Banafshi is teaching there, and she has much knowledge. Yes, so if anybody has any questions or recommendations on their career path on that, we can help, and I'm sure Dr. Mihaela can give her insights as well. And then the Canadian board, I'm interested to know as well, like, because you were practicing before fillers and Botox already, but what was the exact importance for you to have a training like the Canadian board? Or was it more for the training or for the qualification?
But it was definitely for the qualification. You have to have, as per Dubai Health Authority, general practitioners do have to have DHA approved courses. So it's absolutely one of the top reasons. And on the other hand, you do, you know, find people with the same or similar interests. Some of them that I met over there, and we are still, you know, having a coffee or just liking each other's posts. You learn from them as well. Whoever is doing something different, you know, whoever is different type of the personality, you will always learn more from them. If someone is completely same like me, they have same ideas, they, you know, they practice the same, I will not be able to learn anything.
True.
But when you see a variety, you know, how someone injects, if it's 100 times something is different, you will be able to learn, you will be able to absorb, you will be able to understand, you will do your own in the end. But as long as you see as much, as long as you absorb as much, you will definitely upgrade yourself. It's never ending story. You have to learn.
And I also heard many times from my mentor myself, Dr. Maria Khatta, who was the owner and founder of IMA. She always said, it's always worth going to seminars and conferences, even if you think you know the topic, you know the subject, and you're an expert in it, because even if you walk away with one new information, that is the information that takes your practice further. Yeah. So definitely.
Yeah.
And
that's true.
In terms of lasers, so are you performing laser treatments now? And is that a big part of your practice as well as injectables?
Yes, I'm currently in 2 different clinics. I'm in Eternal and Dubai Cosmetic Surgery. One clinic is more based on the injectables, and the other one is based more on the machines. Mm-hmm. They're having amazing machines. Yeah, I love that opportunity, and it does make a big difference. You have to be very, very careful. You will get a lots of different queries because people, they don't fully understand the area. They know there are lasers. They usually think it's one laser, but they have the idea it can do everything. So the education of the patient is very important, and setting up the real expectations. And then in the end, if they go with it and then we get the results, it's really amazing. It's amazing, especially in the aesthetics, because people are very afraid. They, you know, whatever you see online, if it's visible, you know it has been done, right? So as long as it's already visible, this is something that most of the people don't want. Yes. And with the laser machine, you can really improve the quality of the skin, even to the lifting of the face. Lots of small things, lots of small concerns, and no one would be able to see that something has been done. So it's a big value that one can bring into the clinic, absolutely.
Yeah, and I think the specialty of aesthetic medicine is heading more and more towards the use of lasers and energy-based devices rather than the use of injectables, as a combination for sure, but there's more and more awareness about this.
Even in the industries, right? I mean, the science, it goes, but I mean, fillers we have, you know, now for example, they're bringing back the collagen. We used to have collagen. So I believe, I somehow feel that when it comes to injectables, that ideas are a little bit plateaued at the moment. We don't have something new going on. In the terms of the lasers, we are still getting new wavelengths on the market, new ways of delivering the energy, new safety features. So it's, yeah, it's amazing. It's not very easy to keep up with it and fully understand. So you have to be quite engaged, but it's amazing what's going on. We'll see what will happen.
Yes, we can see from your face that you're enjoying working with lasers. It brings a smile to your face. Great. So I don't know if today we have any doctors or practitioners who are new to Dubai, or maybe not in Dubai, but for sure in our channel we have a few followers, you know, that are considering a move to Dubai or just arrived in Dubai, and Dubai continues to be so attractive for overseas experts. So we've all been there, done that, but you're the doctor and you've done it. You've started a new career in Dubai. What would be your advice to practitioners that are thinking to move to Dubai or just arrived in Dubai nowadays?
I think the most important thing for them is that they are final product. Not final in the terms that they should not develop more. They need to be fully sustainable by themselves, because Dubai is not environment where you will be part of a team and you will be developed by the team. It does not happen. I had a different course because I came here with my husband. So I had to find my way through the whole system, and I needed to network. So if you are able to finish your specialization, do it. Don't come as an unfinished product, because there are so many doctors here chasing for the opportunities, and then you don't have time to go back home and maybe finish something, because you will lose everything that you have built here.
Yes. Very good point. So yes, I would definitely support what you said, that in other words, Dubai is quite competitive. Yeah. And you need to bring the new.
Here, might be because they plan, might be because they just jumped into the story like I did. Absolutely observe what's going on, listen, and then learn from it. If there are small things, compensate. If there are big things, and if something is very important to you, don't compensate, but find your spot.
Yes.
I mean, I believe this was the most challenging for me. My first job, I had to give IV to everyone, which I didn't find it, very ethical. And I was very new, so it was all shocking for me. So in the end, I find even aesthetics more ethical in, up to a certain amount, is because if you want to do something extra, right, it's not necessary, and we all agree it's not necessary. You will live without, enhancement. But if you want it, okay, I will explain you what are the possibilities, what are the risks, and then you will make your own decision. And of course, if you're able to practice it in that way, I believe it's fully ethical and it's beautiful, especially if you're able to deliver what the other side really wants. So you listen.
Yeah, very interesting. And if you don't mind just taking the example maybe of your clinic, you've been with Eternal Clinic for a while, and they're a very well-known clinic in Dubai with a great team of doctors and good amount of patients. And as you said, the doctor, has to develop him or herself, and it's a joint effort with the clinic. So the clinic will advertise your expertise, will definitely bring some patients, but you're also expected to work on yourself, on your skills, on your trainings, on your qualifications, on your profile, so that patients keep coming to you. So how's been, like, for example, your personal experience with this? Like, how much effort did it take for you to build your profile here?
I mean, first of all, one of the reasons why I joined the Eternal, maybe the Yanya, the management, she's operation manager over there. Maybe she knew how to, kind of invite me. So she absolutely, what she said is like, we are here to support. There is certain amount of money that we are always giving for the advertising. And we have Dr. Malda, she's Galderma trainer. She will be there to support you and teach you if you need any support. So absolutely, I love the idea, right? So because it's not something that you get here.
Yeah.
And then in the terms of you being activated, absolutely. I mean, you have to put yourself out there, right? So if they if the clinic comes with the request, let's do the video. Like, you cannot, hide. You have to do it. You have to learn your task. You have to have the knowledge. When they send you the patient cannot be disappointed. And of course, you have to build your social media network. You have to build your portfolio. So once the clinic propose you as a doctor that you will have the booking with, they will always double check online. There are many tasks that you need to make, and then for yourself, you will be building the relationship with the patient. The patients might be sending you their friends. Apparently, in a South African group, my name is popping up. So I really love it. Whenever I have someone from South Africa, I'm very, very happy, because most probably they somehow they found my name over there. It does make a big difference.
Yeah.
There is a big Balkan population. So if you're able to make that impression to someone, so that someone can pop up your name somewhere just for them to give a lead, and then if everything else is in the place, it can be a nice opportunity for you to grow.
Is your marketing person, basically, talking about you to friends and family. So as you rightly said, even if the clinic is supporting you and is going to invest some expertise, some time and some budget into marketing your expertise to get you patients, ultimately it's very likely 95% that the social media person or the marketing person or the clinic manager will come back to you and will ask you, I need you to do a video for me, or I need you to appear on social media. So you will have to develop that skill set eventually, definitely in a place like Dubai. And my next question to you was actually about this, because on Friday we have at InvictaMed a communication forum, which is the first time we're doing a training for medical practitioners on this topic, and you've registered. So I wanted to hear from you, like, where do you see the benefit and why did you want to attend this kind of training?
So I have been working for a big company before in Dubai. It was my second job. I worked for Aetna. During my engagement there, we have been bought by CVS Health. So officially, we have been the second largest company in the US. And we have regular trainings. It happened on a yearly basis, on a side from the laws and a bunch of different things, but we also had the communication skills. It was telemedicine. All my calls have been recorded, and our boss was occasionally getting into the recordings, checking what we have been done, how have we been speaking to the patients, and then once we had our meeting every 6 months, she would give us grades. It was the medical part, the clinical part, how well we managed the case itself, but also communication skills. So I have been... It was nice to get that update on every 6 month basis and have once a year trainings, and I do miss that.
Yes.
So the company, so I don't have that. I don't work for them anymore. They have been forwarded to Allianz Insurance, and since that was cancelled, I do miss that. And once I have seen this opportunity, I immediately said, hi, Milton, I want to participate. Please put me in.
Very nice. So that's very interesting, because as you rightly said, so corporate companies, so basically, the non-medical world of business and small, medium-sized, large companies, all of them actually for many years have been doing ongoing training and development for their staff, and communication skills has been long recognized as one of the essential skills for staff to develop and maintain in order to build stronger relationships with clients generally. And even communication skills in our day-to-day personal life plays a big importance, the way we communicate with our friends, with our family, with our colleagues. But in the workplace, it's even more important with clients, because clients tend to build an opinion of their supplier very quickly, and there's a way to communicate your expertise, there's a way to overcome obstacles, objections, concerns from clients, and this can really go a very, very long way. So we've started to introduce this to the medical field in Dubai, and more specifically to the aesthetic medical field, because especially with aesthetic medicine clinics, I think the expectations of aesthetic patients is extremely high, and higher, I would say, than a regular patient. And I think very often we call them clients, we don't call them patients. So hence also, the link and the need with grooming the communication skills of the providers, just like we do in any company, because when patients walk into the aesthetic clinic, I think they have the same expectations as when they walk in Louis Vuitton, Chanel, or five-star hotel. They expect to be treated like in a certain way.
I have some numbers for you. Dermatologists are only under Dubai Health Authority, so I don't have the access to the other. But so under DHA, 765 dermatologists, plastic surgeons 428, aesthetic beauty therapists 727, laser therapists 638, and the general practitioner, it's my category, 5,255.
The numbers speak for themselves.
So it's crazy amount of people. Dr. Malda in Internal Clinic, she's doing on Harvard Business School, and she had a presentation. Apparently in Dubai, we have the biggest number of plastic surgeons per capita. It is
more than Brazil.
Yeah, it is okay. You can count that we have lots of workers, on the constructions areas. Those people will not come for the plastic surgery. So in those terms, yes, we want to be a medical tourism hub in Dubai, but you have to somehow pop up and be recognized. And if your clinic is bringing you clients, if you are not ready to keep them for yourself, because tomorrow the clinic next door will have better promo for Profilo.
Yeah.
That's absolutely, they will go there. As long as you maintain a good relationship with them, if they trust you, if the bond has been made, you will keep them. And even though the clinic might not be sending that many patients, you will be stable.
Yeah.
Even
Absolutely.
the environment is changing, you will be stable. So it's important to make that bond. Without that bond, there are so many other doctors out there.
Exactly. So I love what you're saying. So I think definitely the most essential criteria, of course, is the quality of your clinical expertise and skills, making sure that you deliver results in a safe way. But once that is delivered, there is still a lot of competition there, because there's a lot of doctors that are also well trained, that also have great technologies in the clinic. So where do you make the difference, and how do you make sure that patients keep coming back to you? Because as you said, the clinic next door will always have a better offer than you somehow. And this is you who will make the difference, who you are, how you talk to them, that special chat that you have with the patient when they come in. And they don't want afterwards to go to anyone else. They want to go to you. And communication skills is a big part of that, absolutely. And those numbers were very good. So yes, definitely we had some of these numbers, but you added some of them to our knowledge. So it's growing every day. I think those numbers that you've quoted, if we quote them again in a month's time, we can probably increase it by 10-20%. So it's really, really growing.
These are the numbers without Dubai Healthcare City, right?
Yes.
Without Sharjah, which is the second biggest city in UAE, without Abu Dhabi. So numbers are crazy.
Numbers are crazy. So last question for you before we close this session is, let's talk a little bit more about communication skills and on social media. We just touched upon that, the fact that, yes, exactly. The fact that ultimately, this is the way that clinics manage to build their traffic in the clinic, And as you said, even if a clinic or a doctor has very strong word of mouth and very strong reputation, and if you're fully booked, I had this very interesting question from somebody 2 weeks ago. I'm fully booked. I actually cannot take any more patients for the next 3 weeks. Do you think I still need to be on social media? And my answer was yes, because what will happen is if you have a very loyal patient that kindly refers you to a friend, that referral, that recommendation will probably play like 80% in convincing the friend to come and see you. But the remaining 20%, that patient will do their own research to make sure that they know themselves who you are, that they can read about you. And where are they going to do that? They will Google your name, they will go to the website, they will go to Instagram. So usually Instagram and social media is a place, of course, to attract new patients, but to also, again, continue to give that trust in who you are. Put a face to a name, put a voice to a name. So when that patient sees you and the friend said, Dr. Mihaela is great, they will be like, yes, she is great, I'll book the appointment. But if they don't see you on social media, they don't see you online, they will question that recommendation from their friend. So this is important, and actually you will see that maybe that will impact your patient flow as well. So why do you think it's so challenging for physicians and practitioners nowadays, yes, to appear on social media?
I don't know how about others, but for me, it definitely puts me out of my comfort zone. And that's the main thing, you know. I'm very, very relaxed when I'm explaining to my patients what's the idea behind the sculpture, for example, you know. I was very, very comfortable. And then what we started doing is that we made casual videos. I don't care about the filters. I'm not adjusting anything. I'm doing my best just to